Welcome to Leaders of Tomorrow Weekend Edition. I'm Sunanda Jai Seelan. In this special series, Eye on Dubai, we bring you the most innovative companies and businesses out of the Dubai UAE market and talking about really all the innovation that's taking place in that market. Let me quickly introduce the three companies that are going to be joining us tonight. First up, we have Arab Health Informa. We will have Dubai Health Authority that's joining us on the show. Also joining us live on the show tonight is going to be Aster DM Healthcare. On tonight's special show, we're going to be talking all things health tech and pharma and what's really going on as far as the healthcare market in the Dubai UAE region is concerned. How are the companies and entrepreneurs there responding really to the opportunities which have been presented by the market? What are some of the trends we can be looking forward to? Well, some of those questions being posed to the companies by a reporter who's joining us from on the ground, Davina Monroe. Davina, you're going to be in conversation with two companies. First up, you have Arab Health Informa, I understand. Take it away, over to you.
Hi Sunanda. Now, despite the ongoing challenges of COVID-19, companies from around the world are flocking to Dubai to attend Arab Health 2022, the largest exhibition and conference for the healthcare sector in this region. We caught up earlier with Ross Williams, the exhibition director of Arab Health 2022 and Informa, and he told us about the significance of this event. Here's what he had to say. Ross, thank you so much for joining me on Leaders of Tomorrow.
Thanks for having me.
Talk to me about the significance of Arab Health as an exhibition and conference, and how has interest and participation in the event changed over the years?
I think it's fair to say that Arab Health is one of the most, if not the most important healthcare trade show in the world, complemented by the conferences and the CME programs that we run alongside it. We can see this year we're welcoming over 3,500 exhibitors from over 60 countries, and we have over 20 country pavilions from everywhere around the world. Some that we lost in 2021, unfortunately, but a lot of them are back and bigger than ever in 2022. And I think that just shows how important the show is to people. You know, coming back and doing business face to face again in a trade hub like Dubai that not only serves the Middle East and the GCC, but the whole world. People are really interested in Dubai as a destination, but the show as well, because they know that they generate business from it, and that's the most important thing for these guys at the end of the day.
How has Dubai managed to consistently attract global companies to these types of events, and what would you say are the main advantages it offers as an events destination?
Well, I think Dubai's been open for a long time. We got back to business, as they say, in fairly early last year. We started running events in Dubai early as well. Arab Health ran in June 2021, and there was a whole lineup of events that run along the same time. Expo 2020 has been open now for the last 3 or 4 months. That's been a huge draw for people. Dubai is a trade hub, and it always has been a trade hub. So as I said before, it's not only the Middle East and GCC that come here to do business, it's Asia, it's Africa, Europe and the Americas as well. So people are interested in Dubai. It's always changing. There's lots of new things going on year. You might come here one year and the next year there's something, another huge building down the Sheikh Zayed Road. You know, it's an interesting place. And as I said, it's a hub for business. So deals do get done here. So I think that's enough to keep people coming. Obviously, we deliver a very successful trade show on the back of that as well. And it's nice to bring people to Dubai in January, where the weather is nice, people can extend their stay here and get to see a little bit more of Dubai. So I think Dubai is a really important partner for us, I guess you could call it, because it really does help us bring the people in.
Indian companies are well represented in Dubai's healthcare sector. How are these companies leveraging Arab Health as a platform to expand their reach in the Middle East?
Well, India has always been a huge partner of ours, and there's always been very high turnout from Indian companies. We have representation from the Pharmex Pavilion, who I think have brought probably 28, 25 companies. And there's a lot of other guys spread out across the show floor, each of them offering different products and solutions.
What prospects do you see for expanding the UAE-India cooperation in healthcare?
There's lots of opportunities. As I said, this is a great platform for those guys to be able to do that business. I know that the UAE and the Indian governments are very close and they work together on a lot of things. We see a lot of the companies here are Indian owned. Some of the hospitals are owned by Indian groups. And I think that's really important. You know, India is a short journey away. And there's obviously been lots of business done over the years, and it's an important trade partner.
Thank you so much for that, Ross.
Thank you.
Well, judging by the strong turnout that we're seeing here at Arab Health 2022, it's safe to say that business is open in Dubai, and healthcare will remain a key sector for the Emirates' economy that is offering plenty of growth opportunities. Sunanda, back to you.
Davina, so you have a second interview. This is with the Dubai Health Authority, giving us and our viewers here a slightly more macro picture as well when it comes to the healthcare market. It's back to you. Bring us this conversation. Tell us what's the latest that's happening as far as innovation is concerned, policy, and some of the trends really in the healthcare market.
Hi Sunanda. Dubai has set a precedent when it comes to government response to this COVID-19 pandemic. Part of that success can be credited to the robust healthcare sector we have over here and the strong adoption of smart, new, innovative technology. We just caught up with Dr. Mohammad AL Redha, Director of Smart Health and Health Informatics at Dubai Health Authority, and he told us about a brand new initiative being rolled out that is transforming the healthcare sector here in Dubai. Here's what he had to say. Dr. Redha, thank you so much for joining us on Leaders of Tomorrow.
Thank you for having me.
What does NABID stand for, and can you tell us about this digital health initiative?
Sure. NABID stands for Network Analysis Backbone for Integrated Dubai Health. It is a platform that is pulsating, hence the word nabd from pulse, heart pulse, with data that enriches the Dubai healthcare sector with patient data. It is by definition an HIE, a health information exchange platform that allows connectivity between public and private healthcare facilities in Dubai.
Explain to me how this system leverages advanced technologies and how does it all work and change the healthcare experience?
Well, the technology is secondary when you come to the benefit, of course. The value added from platforms such as NABID is when the patient arrives to any healthcare facility in Dubai, wherever they wish for to get treated by that healthcare professional, their data is available at the fingertips of the healthcare professional. So the value is more of data and information that is available, and then the technology, of course, that we have around us today is amazing technology that enables that to happen. I can imagine technology will become faster and better, and more and more value will be added in the future as well as the technology grows, as you can imagine.
What has the response been to the initiative following its launch, and how many facilities in Dubai are actually using this technology?
Right now, we have more than half of the hospitals working in Dubai that are using this platform, and we have a total of 234 facilities conjointly with our colleagues in the Ministry of Health and Prevention through their platform, which is the equivalent of NABID, but called Ri'ayati. So we have 234 facilities connected. We have more than 29,000 healthcare professionals enjoying the connectivity, and we have access to 7.6 million records.
By when will all healthcare providers be connected with the NABID interface?
2023. We envision that we'll have all 4,000 facilities working in Dubai connected to the NABID platform.
How has technology and innovation changed the healthcare sector since the beginning of the COVID outbreak until now?
I think pre-COVID, the healthcare sector has been enjoying a very rich plethora of technology around it when I compare it to other industries. That has been always in use through wearables, through gadgets, through multiple technologies. And of course, platforming was always there. Electronic medical records, electronic health records, and HIEs have always enjoyed better and better technology. So now, both being an HIE has grown in that domain as well.
What are your current views on the Dubai healthcare market, and what are the top trends and opportunities you're seeing?
We are always guided by the new technologies that are published by our colleagues at consultancy firms. So we are not reinventing the wheel here. What we are reinventing really is the speed of adopting technology. And I think if we adopt a technology, we go and we're very serious about it. We at Dubai Health Authority, we put in huge effort of proof of concepting that technology and making sure that technology will be tested as fast as possible in order to help the patient use it. If not, we say thank you so much. We have failed together. Okay, and we're not afraid because that is one of our mandates.
Dr. Redha, thank you so much for that.
You're very welcome.
Well, Nabid is just one of the many innovations that we see emerging here in Dubai's healthcare market. In fact, being here at Arab Health 2022 is absolutely fascinating because this conference gives you the opportunity to see these innovations firsthand and a glimpse at what the future of healthcare actually looks like. Sunanda, back to you.
All right, Davina, thank you so much for both those interviews. Let's slip into a short break. When we come back, Aster DM Healthcare joining us live on the show. Back in just a moment. Welcome back. You're with us here on our Eye on Dubai special series. Tonight, in this segment, I'm in conversation with Aster DM Healthcare. Dr. Azad Moopen, the CMD Chairman and Managing Director of Aster DM Healthcare, joining us on the show at this point. Dr. Moopen, thank you so much for your time. Good having you here because you really are at the heart of all the changes that are taking place when it comes to the healthcare market. So maybe before we really come and talk about some of those changes and how you as a company and as a healthcare provider responding to that, just a sneak peek into what that entrepreneurial journey has been like for you, really leading up and setting up of Aster.
Thank you. Thank you very much for this opportunity. We started in 1987 as a single doctor clinic, and we are now a large conglomerate of hospitals, clinics, pharmacies, and many other things. And the whole idea of starting this was to provide quality healthcare at affordable cost closer to people. And at that point of time, when I started the first clinic in Dubai, there was actually no accessibility of healthcare to most of the people. Dubai was so small and we had very preliminary healthcare only. So at that point, it was badly required. And that's where we started this journey. But then we spread to 7 countries, and we have now presence in many of the geographies where we are providing the same service. So answering your question, yes, bringing good healthcare, quality healthcare, and making it accessible and affordable to people. And what we are now doing is that even taking it to the homes of people, so that through the digital technology and all. So that whole idea is to get closest to the people.
Could you give us an overview of Aster both in the GCC as well as in India?
Yes. So Aster has been traditionally, initially we started off with clinics, which we have now nearly 120 clinics across many countries. Then we went into hospitals and pharmacies initially, and we have started pharmacies which provides medicines to the people who come to the clinics. Then we moved on to hospitals. And that is the ecosystem which we have created, where the patient comes initially to the clinic. If he requires some medicines, go to the pharmacies. And then if there is a reference required, he goes to the hospitals. Then we started expanding the hospitals, because what we had initially was only hospitals which were providing primary care. What is required actually is beyond that, tertiary and quaternary care. So we started hospitals which were providing that. So if a patient comes to us, it can have everything starting from a primary care, that's a consultation, to even a cardiac transplant. So that's how we have structured it. And we also did something else. We wanted to touch the whole, the strata of populations, not only the rich or the middle class or the poor. So we have 3 brands in UAE, which caters to the 3 segments of population. Aster is a brand which is for the family crowd, middle income group. And we have another one, Medcare, which is to the upper income segment. And then we have another one called Access, which is catering to the blue collar workers. So we are wanting to touch all the segments of the population. Aster in India has got now 14 hospitals. We have nearly 3,000 beds in India, mostly in South India, the 5 South Indian states. And we have more than 12,000 people in India, and doctors, large number of doctors and nurses, as well as pharmacists and other people. Even in GCC, we have, even the number of beds are only around 1,000, we have large number of clinics and pharmacies.
In the previous 2 interviews that we had on the show, we were talking about innovation technology and the role it plays when it comes to the healthcare industry. Some areas or segments or sectors where you feel that perhaps we need to see more and more of technology and innovation when it comes to healthcare?
Yeah. So when you look back, healthcare is one area where technology, from the point of view of investigations and all, have caught up really. We have now the CT scans, MRIs, and many other investigations, robots and things like that. But when you look at the normal day-to-day healthcare requirement, the contribution of healthcare has been very low until maybe 1 year back. Now it's slowly getting changed. What I mean is that if you have to have a consultation, even now, you book an appointment with a doctor, go there, wait for some time, get the consultation, maybe he orders some tests, go to the doctor again, get the prescription, go to the pharmacy, get the medicines, come back home. The whole thing takes a minimum of half a day, if not a full day. That is completely unacceptable in a situation where you don't do this for things like banking, you sit at home and do that. Or when you look at buying something, you get everything at home, you can order and get the things. So healthcare hasn't moved in that way. So what is required is healthcare to move in such a way that at least for primary care, for normal illnesses, people should be sitting at home, having a teleconsultation where they will be seen by a doctor. A prescription is sent to the nearest pharmacy, from where it will be delivered to their homes. That is something which should happen, and I'm sure that within the next few years we'll have that.
What I find personally interesting, Dr. Moopen, about Aster Healthcare is the fact that you're the only healthcare company from the Dubai UAE market to have listed in India. So, why did you decide to do that? What's the kind of potential of the healthcare market as you see it that you want to tell our viewers about?
So we are probably one of the very few companies which have got large operations outside of India, which got listed in India. So we are very proud about that. And talking about the opportunities and potential for healthcare, India is the place where you have the largest opportunities. We have 1.3 billion population, and we have huge gaps in demand supply. So there is requirement for everything. See, even from the point of view of a GDP spend on healthcare, we are spending around maybe 1.5 to 1.8%, which has to go up to 7 or 8%, even in not the Western countries. There it is even higher, 10%. US it is 18%. So we have to, that gap is huge, and we have to fill that. Everywhere there is opportunity, and government is doing a good job with many of these things which have been rolled out, like the Ayushman Bharat. And there are a lot of requirements in the tier 1, 2, and 3 cities, the metros everywhere for healthcare.
We were talking about the opportunities of the domestic market here in India, Dr. Moopen, but through this interview, as a last question, I would love for you to talk about the potential which is being presented by the Dubai UAE market, the GCC region, as far as healthcare and health tech is concerned. For an Indian entrepreneur who's watching, what do you want to tell them?
So UAE is a place where I call it an oasis of peace and prosperity in the middle of a desert. And the best part is that the visionary rulers of this country has created an ecosystem where things are so easy. The ease of doing business is tremendous. You have everything within such a short period, and everything is actually digital. So you don't waste time, and it moves so fast. If you have to get a license, it happens within few days or maybe a week or so. So again, as I said earlier, you have to find out if you are having an interest to set up something. There's no better place outside of India other than UAE, because it's like an extended part of India with the 40% of the population from India. So you always feel that you are at home. Now, looking at the opportunities in healthcare, what they should look at is the newer technologies. The startup ecosystem is very strong in UAE, and the innovation is now the order. So what they should try to do is that look at areas like, for example, genomics, or areas like artificial intelligence related to healthcare, or other areas like blockchain, where there's a requirement for that to be there for security reasons. So there are a lot of areas which are connected to the IT and the newer technologies where healthcare is connected. So that will be one of the very good areas where the entrepreneurs from India could look at, apart from the brick and mortar things, no, which is expensive and time consuming, and it's something not going to happen immediately. But these are all things which can happen immediately. And I suggest that people look at the healthcare ecosystem where technology, like the newer technologies, are in vogue, and they should take up such areas.
All right, Doctor. Thank you so much for your time here on the show. We've run out of time, but I really appreciate you taking the time to talk to us. Out of time on tonight's episode. If you have any feedback for us, our contact details on your screens as we speak. Thanks for watching. Have a good night.